Decades of graft preparation experience and feedback from surgical teams have culminated into the GraftPro Graft Preparation System. The GraftPro system has numerous features that simplify and accelerate graft preparation of soft tissue, BTB and GraftLink grafts. The GraftPro instrument case is efficiently housed in a small footprint case that occupies minimal space on the instrument table. The graft prep board sits above the attachments and is removed first. The graft prep board and attachments are laid out logically and clearly marked for simplified setup and quick assembly. All attachments fit into custom bracketing with matching graphics. An open mat area allows additional instruments to be added as desired. A graft sizing block is also included. The GraftPro board is lightweight and has non-slip feet to facilitate usage on side table or Mayo stand. A large graft cleaning board facilitates removal of unwanted tissue and graft trimming. 5 quick-release connections are located both in fixed and sliding positions and will accommodate all attachments. Dual tracks with ratcheting sliders allow one-handed movement of attachments. Sliders are released by squeezing tabs and allow movement in the opposite direction. The board also includes a well for BTB preparation, which secures bone blocks while cutting and drilling. 2 graft clamps come with the set and have been designed to effectively hold tissue grafts atraumatically. Narrower jaws also help facilitate loading of grafts into the clamp. Quick-release attachments facilitate speed whip suturing technique with fiber loop by permitting one side of the graft to easily be removed from the board, allowing passage of the fiber loop around the graft. The graft can then be re-secured into the board so both hands can be used for needle passing and suture tensioning. GraftPro attachments can be rotated in any direction, allowing graft positioning in several directions. Two posts are included in the GraftPro set and can be used in a variety of ways to hold and tension grafts and graft sutures. The smooth surface and curved recess is ideal for atraumatically securing soft tissue grafts as shown. The button holder with ruler secures ACL tightrope and retro button implants and allows measurement of the loop and graft to facilitate button flipping and graft advancement. The spring-loaded latch is depressed to load the button into place. The latch then automatically closes over the top of the implant and holds it securely during graft prep and tensioning. The tensioning strands of the tightrope RT are accessible from the end of the attachment and may be pulled to customize loop length. The built-in ruler allows measurement and marking of the implant loop and graft for later reference during implant and graft passing. The GraftLink attachment secures an ACL tightrope button into place with a spring-loaded sleeve that closes over the button to hold it securely during graft prep and tensioning. There is also an alternative rubber grommet option for attachment of the ACL tightrope ABS loop or graft sutures. Additionally, this attachment incorporates a tensiometer to approximate tensioning force. Note, when loading ACL tightrope implants into the button holders, the inferior limb of the blue passing suture should not be positioned superiorly, as shown here. This will make button loading more difficult. The inferior limb of the blue passing suture should be positioned inferiorly, as shown here, to facilitate button loading. The BTB well helps to secure bone blocks during cutting and drilling. Rulers along the top and side help approximate graft sizing during preparation. The open center slot allows passage of drill bits and needles through the bone block. The graft sizing block helps approximate graft diameter from 4.5 mm to 12 mm in half-millimeter increments. When placing the board into the case, orient the board so that the cutting board portion is directly over the attachment brackets. The sliders must be positioned over the open pin mat area for the board to sit flush and allow the lid to be seated.